Hey everybody, this is Dr. Paul Thomas with Plum Health DPC here in Detroit, Michigan, and I'm talking about some of these misleading headlines that I've been seeing circulating in the Detroit media lately, and it's been really upsetting. So again, my name is Dr. Paul Thomas. I'm a family medicine physician. I work in Corktown, Detroit. I have a team of doctors that I work with here in Corktown and also in Farmington Hills, and our service is called Plum Health. But what I want to talk about today are these headlines. You've seen this headline circulating if you've been in the Detroit media lately. 246 infected, 3 dead from COVID-19 in Michigan despite being vaccinated. I saw that in the Independent. I saw that on Fox 2 Detroit. I saw that in the Free Press. And this is all really upsetting to me because these news media organizations didn't take into account the fuller context of what's going on with coronavirus here in the state of Michigan. And so if you look at this data, so far about 19% of Michigan's 10 million residents have been fully vaccinated. That's 1.9 million people have gotten, 1 or 2 doses of the vaccine, whether it's Johnson & Johnson or Moderna or Pfizer. So 246 cases out of 1.7 million people goes to 0.01447% of those who are fully vaccinated actually got sick. Stated another way, 99.99% of those fully vaccinated in the state of Michigan did not get sick from the coronavirus. And then for the deaths, 3 out of 1.7 million people who are fully vaccinated died, which is of course unfortunate, but that's 0.0017647% of those who are fully vaccinated who have died. Stated another way, 99.9999% of those who are fully vaccinated in the state of Michigan have not died from the coronavirus. And those are the things that we need to keep in mind when we look at headlines like this. So the questions that need to be answered from these headlines that weren't answered in those articles is, how old were the people who got sick? Did these people have pre-existing conditions? Were these people taking medications that would suppress their immune system, like steroids or drugs for autoimmune conditions like rheumatoid arthritis? Did these patients have HIV or AIDS or any other condition that suppresses their normal immune function? And did these patients die from COVID, or were their deaths due to another cause like a heart attack or stroke or something like that? I think a more responsible headline would be something like this, tweeted out by Ross Jones with Channel 7. Among 1.7 million fully vaccinated Michiganders, state identifies a small number of COVID-19 infections and deaths. And yes, there will be breakthrough infections. Like with any vaccine, the vaccine is not 100% effective. The estimate is that the vaccine is 95% effective in preventing severe infections if you get the Pfizer or Moderna. There will always be breakthrough cases. There will always be breakthrough deaths, but those are so infinitesimally small that it's really hard to wrap your head around how small those numbers are. So if you see 246 cases, you have to remember that in the context of 1.7 million Michigan residents who have been fully vaccinated. So an ideal headline might look like this: 99.99% of vaccine recipients in Michigan have not become ill with COVID, or 99.9999% of vaccine recipients in Michigan have not died from COVID. But those headlines won't be printed because a lot of times our news media is looking for clicks or attention or time spent on their site, and those sensational headlines do get our attention. But I just want to be here to set the record straight that these vaccines are safe and effective. The best way to protect yourself is by getting any vaccine that's available to you. That could be the Pfizer, the Moderna, or the Johnson & Johnson. All of them are safe and effective. And the way to do that, if you live in the city of Detroit, is to call 313-230-0505 Monday through Friday, 9 to 6. Any resident over the age of 16 is now eligible. So if you can drive a car, you should drive yourself down to TCF Center and get this done for yourself. Protect yourself, protect your loved ones, protect the greater community. and reduce your risk of getting the coronavirus. Thank you so much for watching, and have a wonderful day. Take care.